Hello, everyone. It's Thursday, January 21st. There's a lot going on within West Virginia. We all know there's a lot going on within our nation. But, and there's no point in me. It's just going to hopefully, we hope and pray, just keep getting better and better. We've lost an additional 35 people in the state of West Virginia in the last couple of days. To just tell it like it is, I'm tickled to death that we've only lost 35, even though every one is too many. But I'm going to read these, but trust me, it's a whole heck of a lot better than I think where we've been, even though this is for 2 days instead of 3 or 4 days. I would also caution everyone that one robin doesn't make spring. And just a little bit of good news is something that I truly believe we should pass on, encouragement and enthusiasm to our people and everything, that there is light, and there's always light because of the good Lord, but there is light here at the end of this tunnel, and we're going to get there. Our 1,815th death is a 92-year-old male from Fayette County. Our 1,816th death, a 46-year-old male from Raleigh County. Our 1,817th death, a 78-year-old male from Pleasants County. Our 1,818th death, an 82-year-old male from Wood County. Our 1,819th death, an 86-year-old female from Wyoming County. Our 1,820th death, a 55-year-old female from Mercer County. Our 1,821st death, a 72-year-old male from Mercer County. Our 1,822nd death, an 85-year-old female from Jackson County. Our 1,823rd death, a 75-year-old female from Berkeley County. Our 1,824th death, a 79-year-old male from Raleigh County. Our 1,825th death, a 90-year-old male from Putnam County. Our 1,826th death, a 59-year-old male from Cabell County. Our 1,827th death, an 87-year-old male from Mercer County. Our 1,828th death, a 92-year-old male from Harrison County. Our 1,829th death, a 92-year-old male from Fayette County. Our 1,830th death, an 81-year-old male from Mercer County. Our 1,831st death, a 71-year-old female from Fayette County. Our 1,832nd death, an 89-year-old female from Mercer County. Our 1,833rd death, an 88-year-old male from Preston County. Our 1,834th death, an 81-year-old male from Upshur County. Our 1,835th death is a 65-year-old male from Marion County. Our 1,836th death is a 93-year-old female from Wood County. Our 1,837th death is a 72-year-old male from Kanawha County. Our 1,838th death is a 54-year-old male from Cabell County. Our 1,839th death is a 66-year-old male from Mercer County. Our 1,840th death is an 81-year-old male from Doddridge County. Our 1,841st death is a 65-year-old female from Kanawha County. Our 1,842nd death is a 66-year-old male from Harrison County. Our 1,843rd death is a 74-year-old female from Kanawha County. Our 1,844th death is a 68-year-old male from Wood County. This one's really tough. Our 1,845th death is a 36-year-old female from Kanawha County. Our 1,846th death is an 83-year-old female from Wood County. Our 1,847th death, an 84-year-old male from Cabell County. Our 1,848th death is a 78-year-old male from Kanawha County. Our 1,849th death is a 58-year-old female from Hancock County. Each and every one of those is a friend. A mom, a dad, a grandpa, a grandma. You know, each and every one of those great West Virginians have many, many loved ones. Please, please remember each and every one. Keep them in your prayers. their families will hear your prayers. Please join me every day, some way, somehow, in not forgetting these people. Our positive cases in the last 24 hours are 940. Our positivity rate is at 5.25. That's better. Our cumulative rate is at 5.52. It seems to be holding right there, and I hope and pray it does, and then it starts to drop. Our active cases are 25,737. The number of daily active cases in West Virginia has decreased 9 of the last 10 days. That's good, really good. The number of daily active cases in West Virginia has decreased 9 of the last 10 days. Our recovered cases are at 85,031. Before I go any further, Jordan, throw up the graph on the active and the recovered cases. The top graph, everybody, look at the top graph. The top graph is really showing us something. You see the widening of the top graph between the light blue and the dark blue lines? The dark blue line is the active cases, and the recovered cases is the light blue line. That widening is absolutely critical to what we're trying to do. We have 638 people hospitalized in West Virginia. That's down significantly. And 167 in the ICU units. That's down also. We now have 15 counties in the red. That's better. Today, our RT number or reproduction number has moved up slightly, but it's still the second best that I've seen, and it's the third best in the nation at 0.87. I remind everybody again over and over about if you're over 65 years of age and you get a sniffle or a toe ache, go get tested. Because if we catch this early enough, we can give you the antibodies and save your life. As far as going back to school, I am really happy that our schools have reopened to an in-person learning, and it's going smoothly at this time. The pandemic shines a light on the important roles our teachers and service personnel play in the lives of our children and our families and our communities each and every day. I want to thank the State Board of Education for all they're doing to make sure the in-person learning option is made available to all of our families throughout our state. And we have some pictures of children at Jefferson Elementary, in Wood County, and Wood County's working on a blended level at this point in time. And again, I can't say it enough, there is nothing to replace, our kids being in school and receiving in-person learning. Well, I'll just wait. Maybe we'll get questions in regard to that, and then I can answer that in a few minutes. But, on a vaccine distribution update, we're continuing to get shots that we've received across our state into the arms of West Virginians who are choosing to get this done. Now, I'll just step back and just say this. From the standpoint of first doses that we've received, we received doses in on Monday. We're getting them in people's arms, and by Sunday, we'll have all them out again. We'll be back to 100%. Right now, we're at 87.7%. And if we just keep pouring it on, we'll get all those. We'll be right back to 100%. It'll be in somebody's arms, by the weekend, and that'll be great. In the last 24 hours, we gave out 8,991 vaccines in the state. And we're leading the nation because of our partners at the local and the county levels. That's all good. Today, I'm announcing that by February 1st, we will expand our community vaccination clinic model to all 55 counties. So, while we're trying to get these out and get them as many arms as we possibly can get them, we're now going to expand to all of our 55 counties. And this is to make sure that our limited supply of COVID vaccines are reaching every corner of this state. We're trying with all in us each and every day. Now, let me just deviate just a second, because I've got some more notes that I can talk to you about that in just 1 second. Well, I'll just keep going. You know, in regard to our vaccination clinics and our healthcare workers, today I'm announcing that we're going to hold more than 15 community vaccination clinics. Now, just listen to me on this. If you're one of our healthcare workers and you're in the fields of, let me think, you know, of dentistry or physical and occupational therapist or hospice and home health workers, EMS, CPS workers, you know, anybody in behavioral health, all these people, we're going to hold special clinics, you know, vaccination clinics for them, and they're, you know, just for these healthcare workers, 15 of them in the community vaccination clinics. And we will be using our successful community vaccination model to continue to get these vaccines to the critical frontline healthcare workers who've been serving you through this whole pandemic. Our goal is to offer 12,000 individuals who have been working on the front lines of this pandemic. These vaccination clinics will be held in the following counties on Friday and Saturday, or both days. These counties are where these clinics will be for these healthcare workers: Berkeley, Braxton, Cabell, Hancock, Hardy, Harrison, Kanawha, Logan, Mercer, Raleigh, Wood, and Wood counties. I'm going to do it one more time, but if you're a healthcare worker, you got to be listening to me right now. We're going to have clinics to vaccinate just our healthcare workers, and we're going to do that on Friday and Saturday, and we're going to do it in Berkeley, Braxton, Cabell, Hancock, Hardy, Harrison, Kanawha, Logan, Mercer, Raleigh, and Wood counties. It's another example of using the partnerships in West Virginia to get the job done, and that's what we've done. As far as saving our wisdom, you know, and that was our effort to get to our elderly, and we really are trying to put a great big push on that and everything. Yesterday, an hour after the president, you know, our new president, President Biden, was sworn in, you know, I was on the phone with his new coronavirus czar. I was on the phone at 1:30 with him yesterday, and his name is Jeff, and I think you pronounce his last name as Zients and everything. He seemed like a really go-getter kind of guy. You know, I told him of what was all going on in West Virginia. He knew about it. He congratulated us over and over and over in West Virginia, how we've been able to get this in people's arms, and how we're moving and we're getting with it as fast as we possibly can. And then I told him, you know, how we needed more and more vaccines. You know, I'm sure that there's a lot of people that are screaming the same stuff, but he heard me. And I think he heard me very well. And the long and the short of it is, I encourage everyone in our state, you know, everyone knows within our state, respecting the presidency of our nation, and without any question now, we've got to get behind, as Americans would and good West Virginians would, behind the efforts of our new president and try with all in us to absolutely make things better and better for the great people of West Virginia. I also tell everybody, I know people are calling like crazy and can't get through and everything, and I just ask you just again to try to be as patient as you possibly can, be diligent in calling and pushing and everything to get your vaccines, but we're getting them, and the other thing you've got to realize that it's just this simple. If West Virginia hadn't moved the way West Virginia moved, there would have been no point in even beginning to call until April. You know, so we have been successful in vaccinating tens and tens of thousands, and we will continue till if we get more and more vaccines, we'll absolutely pour this on, and we'll get to every single last person in this state and get there very, very quickly. So far, we have vaccinated 37,440 individuals that are in a population of, you know, 75 or older, and you know, who've chosen to get the vaccine, and and you know, we're just going to stay right on that. We do not have enough doses of vaccine for all West Virginians that are 65 and above at this time. We just don't have it. You know, we have had to go to 65 because the CDC wants us to be at 65, and I sure don't want to get our supply cut off because we're not at 65. You may say, well, if you don't have enough to do us all, why didn't you just stay at 80, or why didn't you just stay at 75 or 70? Well, the answer is really simple. CDC controls a lot of the doses that are coming our way, and absolutely they wanted us to go to 65, and we'll go to 65, and we'll gladly go to 65. You know, there's more information on a vaccine info number on our dashboard. You know, I think they'll put that up and you guys can see that and everything. And but we'll continue. We're going to stay right on top of it and everything. I think really and true, if you're just fair, West Virginians ought to be really happy on how we've moved this all the way up to the front, and we got 37,000 of us, you know, that we've gotten vaccinated. That's great. We've also done another thing. There's an Everbridge scheduling system. I hinted about this to you on Tuesday. You know, now I'm going to read that today I am announcing that we will very soon be launching an online, statewide vaccine scheduling and distribution communications tool. It will go live on Monday morning at 8 a.m. We have partnered with a company called Everbridge. This company helps states notify their citizens when there is a fire, a flood, or a hurricane. But now they are going to help us coordinate vaccines as we can get them from the federal government. We will be the first state to turn on this new vaccine scheduling system. They have helped us stand this up during this week, you know, and to accomplish getting it stood up in 1 week's time. This system gives you the ability to put your information in directly and helps us coordinate when vaccines are available to notify you when and where to come to get your vaccine. For all West Virginians 65 and older, you will simply go to the COVID website or call the hotline to get your information into the system. This will keep people from having to call time and time and time again. I'm trying every way in the world, every way I possibly can to make things easier and better for you, and I hear you. And I don't like the fact that you're having to call and call and call. And the great people at DHHR and all the other people have come up with this, and it's really good stuff. For those that don't want to go online, you can still call, and staff will put your information into the system so that when vaccines are available, we will be able to notify you about the availability of the vaccines. You will get a message back after you register to confirm that you are in the system, and we will send you updates regularly. The system sends texts, emails, and phone calls. Whatever way you want us to notify you about your availability, this system will allow you to pick up on just that. I'm excited about this system in place, or going in place, and I truly hope that this is going to be another step to making things just a little less complicated, a little bit easier. All the COVID vaccine information is up on the hotline and everything, or on our lines there. A vaccine reminder again is you got to take your vaccine shot. I mean, it's completely safe, or as safe as we can possibly make it. But you got to take it. You have to take it. You know, tens and thousands, millions upon millions are now taking the vaccine. I don't know if you can hardly identify anyone that is really having a hard time with the vaccine. But without any question, we can identify your neighbors or your mom and dads or your grandpas that are not only having a problem with this, they're dying. They can't breathe. It is absolutely unbelievable how bad it is. You got to take the vaccines. That's all there is to it. As far as the antibodies, I've told you over and over, if you get a sniffle, go get tested. I encourage people to continue to be tested and tested and tested. That's good stuff. Our free testing map is up there on the screen. I thank the drive-through pharmacy people. We have 98 outbreaks now in our long-term care facilities. We have 6 active outbreaks in 5 counties in our churches. The churches have done marvelous work. That's Clay, Hampshire, Nicholas, Summers, and Wetzel County. Just keep remembering what we've been telling you over and over. If you opt to go to church and everything, and I think if you're elderly, it'd be mighty good if you could get your services online. But, because we're close to the end of this rainbow. We're close. We're getting closer every day. We have 163 inmate cases now, 29 staff cases in the state. We have 105 at Lakin that are inmate cases and 49 at North Central Regional Jail. I remind you all the time, wear your mask. Please wear your mask. Get your flu shot. And if you've been blessed especially and you have recovered from COVID, the least you could do is go give blood. It's really important. I want to talk to you just a second about the inauguration. And it's going to be tomorrow at 1 p.m. I will be sworn in during the ceremony along with the Secretary of State, the Attorney General, the State Treasurer, the State Auditor, the Commissioner of Agriculture, and the Supreme Court Justices. I will give an inaugural address due to the COVID guidelines and security protocols. Attendance will be limited to the dignitaries and their families and everything that are being sworn in, and members of the media and other invited guests. However, the event will be live streamed online right where you are, that you can be watching it, as it's going to be live, streamed. The ceremony will be broadcast by West Virginia Public Radio, West Virginia Public Broadcasting and everything, and I encourage all West Virginians to tune in. Please tune in. I want to just take just a second. Like I told you in speaking to the coronavirus czar, the new czar under the Biden administration, I really enjoyed the conversation, and I asked this gentleman, I said, I'd really like you to call me Jim if I can call you Jeff, and we agreed. And so Jeff, thank you so much. If you get any piece of this and everything, I really appreciate, the great call. And I really congratulate our new president, President Biden, and Vice President Harris, and wish them all the greatness that I could possibly wish them. I'll stand ready to work with them in every way. I congratulate, President Trump and Vice President Pence, on a great job and all the accomplishments that they did and worked through, and all the difficulties and everything that I'm sure that they had to work through. But first and foremost, I want to always be just this, and that is super respectful to the office of our presidency. So, President Biden, we wish you and Vice President Harris the very best, and we surely look forward here in West Virginia to becoming friends, and in some way, somehow, bettering things for the people of West Virginia and this nation. I want to announce this on our Fairmont Hospital. Harrison, Marion, and Monongahela counties have the 3 highest rates of infection. This requires us to act now and be prepared in regard to our hospitalization rates. The recent COVID surge is exceeding inpatient capacity at WVU Hospital and the United Hospital Center in Clarksburg. Many individuals are delaying care because there are no beds available there. Based on these statistics, there is an immediate need to increase bed capacity at the old Fairmont Hospital. Now just think about that. We refuse to let it die. Now, just to tell it like it is, if we'd have sat on our hands just a little teeny bit longer, this hospital would have been mothballed. not only did we save a lot of jobs, and not only did we absolutely create a situation to where we have a hospital that is serving Marion County, in the 7th largest city in our state, in Fairmont. At the end of the day, we absolutely have created jobs. We have provided all kinds of care and more convenience for the people in that area, and absolutely done the right stuff with the great city of Fairmont. Now, with all of that, in addition to that, we designated this hospital at Fairmont as the potential to have to be a COVID overflow hospital with 42 bed spaces and everything to be able to do that. And so we did that, as a precautionary move. And now, lo and behold, look what we've got. We're setting at capacity levels at WVU and at the United Hospital Center in Clarksburg. And now, lo and behold, we have the resource there that we protected, and we absolutely protected it first and foremost for the people that are working there and the patients that were coming there in the city of Fairmont. And now the move that we made to make it a COVID hospital is becoming a reality, and it's becoming a reality right now. We'll have to add an additional 65 staff positions to care for these patients. This will enable Fairmont Hospital to care for up to 42 patients and provide the necessary services to meet the needs of the COVID patients and others so that their care won't be delayed. We appreciate WVU Hospital for stepping up and helping us with this important task, and we're committed to seeing that our healthcare needs are met in this region and the rest of our state. Our community hospitals are in many, many ways our lifeblood, the heart of our little communities, and we couldn't let them die, or we had to absolutely try every way in the world to have them live and thrive, and that's happened right here. Now, I want to talk to you just a second about the school map. If we could pull that up just one second, Jordan. If you'll look at the school map, a color that we haven't seen a long time. A long, long time we haven't seen a green. Well, we got a green now. And not only that, we got a bunch of gold, or yellow. And not only that, we got a bunch of gold. And not only that, we got a whole bunch of orange that were red before. So we're moving. We're moving. All of this is upticks in the right direction. You see all over the national news, you see that West Virginia is leading the nation. These numbers can't pivot and go against us, but we got to keep it up and everything. Last thing I have for today is we have a very special person that just happens that it's her birthday today. And so for Jennifer Casto, she's one of our interpreters or signers. And so we just wish her the happiest of all birthdays. And there she is, she's blushing a little bit and everything. So all of you on 3 with me all across this state, let's all wish her happy birthday. I'm not going to go through the singing because that may not be all that great. But we're going to absolutely, on 3, say happy birthday, Jennifer. And so here we go. 1, 2, 3. Happy birthday, happy birthday, Jennifer. Gosh, I said happy birthday, West Virginia. It's been a long day. Anyway, all y'all be so good. Happy birthday, Jennifer. Really proud of you. Thank you so much for all you do. That's all I've got.
All right, thank you, Governor, and happy birthday, Jennifer. First today, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Yeah, thank you, Jordan. Hello, everyone. Happy birthday to everyone out there that has a birthday today. The governor mentioned the online vaccination system and the registration system. He was very adamant to us that that we fix this problem. So as he mentioned, we actually worked very hard this week. I want to thank the folks in DHHR who pulled all this together. We were close to rolling this out in the morning. We're going to give it a couple more days to make sure all of our partners are fully on board with this and that we can make them an integral part of this. Let me talk just a minute about the population we're prioritizing here. As the governor said, it's a population age 65 and over that we're interested in, but I also want to make sure that we understand, that everyone understands those teachers age 50 and over who might have been missed or others can register into the system as well. The fastest way to register into this system is online, or will be online beginning Monday morning at 8 a.m. There will be a link. The information and the forms that will come up on your computer are very straightforward, very simple to fill out. We expect this to take a lot of the telephone load off of our local health departments. Please be patient with those folks. They're doing a terrific job. Let me talk a minute about the priority list that they have, because a lot of you have called local health departments and gotten onto their list. Please don't call the call line or register again. You will keep your priority. Everyone who's already contacted local health department, an FQHC, a rural health center, et cetera, you will keep your priority. We will not bump anyone ahead of you. These lists will be merged so that you retain priority. In terms of, again, expediency, the best way is online, but we also have our call center. We'll be standing up at 8 a.m. Monday morning, as it is now, but Monday morning we'll be able to register folks online on the call, so that if you don't have internet service or do not use a computer, please use the vaccine call line or info line. I think, yeah, Jordan has that on the screen. That effective 8 a.m. Monday morning, we'll be able to register you there. So we're also looking at next week at being able to have that call line available for local health departments, so you can call that line as well. All of this data goes to the same place. This is a cloud-based system. Everbridge has been doing this for quite a while for other areas for state government. We're using this service to facilitate and streamline our vaccination program. We're very excited about it. So again, we will be effective 8 a.m. Monday morning. Thank you, Jordan.
Thank you, Secretary. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. Happy birthday, Jennifer. I want to recognize that today is also the birth date of COVID in the United States. Not to mix that with Jennifer's birthday, but today was the day that the first case of COVID was reported, COVID-19 reported in Washington State. And it's been an incredible time over this past year. And the governor's pointed out, which I think is so important, that West Virginia has done well in many, many ways and continues to lead the way for our country. We do recognize, however, that despite us doing better, seeing our hospitalizations go down, seeing our reproductive rate go down, which is important, we need to recognize that across the world, we have seen almost 100 million cases of COVID-19, over 2 million deaths. In our country, we're approaching 25 million cases of COVID-19 and over 400,000 deaths. And in West Virginia, we've lost 1,836 West Virginians. So we know that the key for us to keep more people from dying, and we believe the reason why we're seeing a reduction in the amount of spread of COVID-19 and of deaths is because of the strategies that we're taking, which is to target the most vulnerable population. We know that half of our deaths came from nursing home patients, residents. We also know that 77.5% of our deaths are in West Virginians over 80 or over 70 years old. And so targeting this population with vaccines is so important to reduce deaths and reduce hospitalizations. Also importantly, as the governor pointed out, and Dr. Amjad has talked a lot, there is new data to suggest that use of the monoclonal antibody, the Lilly drug, in people who are in nursing homes who are defined with COVID-19 can reduce severe disease, and can save people from dying. So that's a really important consideration, and we've been very aggressive in pushing that. Now, as you get the opportunity to get a vaccine, we absolutely hope that you choose to be vaccinated, because that's the key, and we've done well in our state. But it's also really important to recognize that you really do need both of the vaccine doses to get the maximal protection. There's been some thought that only a single dose is sufficient, but it's clearer all the time that you really need both doses. And the other thing that's really important to recognize, that it's about 2 weeks or so after the second dose that you can really feel like that you have the most protection. But that even if you get 2 doses of vaccine and you wait for 2 weeks, it doesn't mean that you have a kind of a free pass, because we know that there is a difference in the kind of immune response you get from getting the vaccine versus getting the real virus, getting ill with COVID. And we don't want people to get ill with COVID. But we know now that there is the potential that if you're around other people that have not had the vaccine, that you could still carry COVID in your nose, and that you could spread COVID, even not meaning to. And so as we focus on getting everybody immunized, it's really important that unless you're around all other people in your vicinity that have been immunized, then you still need to wear a mask, and other people around you still need to wear masks. And we believe that the reason why we're seeing reductions in the spread of COVID-19 based on our map, based on our reproductive score that the governor's talked about, is not only because we're immunizing our population in a strategic way that I think is going to be highly beneficial to reduce deaths and reduce hospitalizations, as the governor has challenged us, but also because I think people are really doing a good job in wearing masks. And we know until we get our population vaccinated, wearing masks is really important. But make sure that even if you get vaccinated, you still need to take care and precaution and protect other people so that you don't mistakenly, inadvertently spread COVID-19 to other people. Otherwise, we're really proud of the great work that's going on. We're getting a lot of good, attention from many, many sources. The governor has, done a fabulous job as the leader. And we look forward, as the governor said, to working with the new administration to work to get more and more vaccines in West Virginia to help more people. So thank you so much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of the Joint Interagency Task Force.
Good afternoon. Just like to point out three things today. First, as of this year anniversary for COVID, we in this country have lost more people, more United States citizens, than we lost in the entirety of World War II. So we understand the sense of urgency. And the governor continues to press us with that sense of urgency every day. 2 things that the governor laid out today, I would just want to reinforce. We continue to work to develop not just a specific clinic site, but a model, a system across 55 counties, because we know we have to penetrate all 55 counties to get to people in an efficient way. And second, the Everbridge system, the governor pressed us to bring on better system and better capability to ensure that we could provide information to our citizens about where they would be based on the availability of vaccines. And then the last piece is, as the governor pointed out, we continue to provide him the things that he needs to press the national level to get us the vaccines that we can put in arms to take care of the population of the state of West Virginia. Thank you.
All right, thank you, sir. Dr. Ayn Amjad, our state health officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams of Ogden Newspapers. Governor, you obviously talked briefly about your discussions with the new incoming coronavirus SAR on the national level. I was really hoping you can go into further detail on that, particularly discussions that you had in regards to vaccines. I know they released a 21-page report Wednesday evening laying out their vaccination plan and how they plan to work with states and use the Defense Authorization Act Production Act to try to get more vaccines produced and out the door. So if you could elaborate a little bit more on those conversations and where things stand. Thank you.
Well, Stephen, I'll try. I'll tell you everything that we talked about, but the first thing he started the conversation by congratulating West Virginia on how we've been doing and everything, and all that was really great. And then the conversation moved towards the fact that he had only been in the chair now for a little over an hour, and that they recognized the shortfall and the situation that there needed to be more and more vaccines go out. I said to him, this is exactly what I said. I said, Jeff, do you realize that really and truly a person that is a West Virginia American is no different in any way than a Nebraska American or a California American, and at the end of the day, if we can get a shot in somebody's arm somewhere, and we can get that in that arm right now, we may very well save a life. Save a life of a great American, no matter what state. And I said, Jeff, it is as simple as mud if you just step back and look at this. I said, really and truly, you have states that are still struggling to get to 50% that have vaccines, and they're in some warehouse somewhere today, right now. Do you agree? And he said, I do. And I said, Jeff, today, right this minute as we're speaking, if I had the vaccines, I can maybe save somebody's life today. And so, Jeff, you've got to some way get us more vaccines. Now, we just received 23,000 and change this week in vaccines. I said, Jeff, our great National Guard and health departments and everything tell me unequivocally that we can get in the arms 120,000 a week, and we got 23,000. Now, we're doing you the best job of anybody in the nation. And I'm telling you, Jeff, we need 120,000 a week. Now, in all honesty, we may not get more than 23, but you'll never get 120,000 if you don't ask for it. And you don't tell him absolutely unequivocally we can do it. Well, that's what I did. And then he turned around and he said, Governor, if you were to have all the supply that you wanted, tell me how fast you could get shots in every single person above the age of 65. And I said, Jeff, without any question whatsoever, all you would have to do is let me show you. But really, if we had an unlimited supply of vaccines, on February the 7th, they'd be done. They'd be done. Every person in our state would have their first shot on February the 7th or before. Now, and he sat there just kind of dumbfounded. And I said, Jeff, please understand that we are the third oldest state in the country, and we are absolutely the #1 state in the country with chronic illnesses. This is a man that is absolutely good at what he does, and he absolutely, got it. And I said, and Jeff, please understand that all we're asking for, we aren't asking for any help in any direction. We aren't asking for staff or people to come in and help us administer this. We've got it. All you got to do is get us the vaccines. You know, for the one conversation that I had with him, it was a great conversation. I hope we can really build on it and everything. You know, I don't know how to plead our case any better than that. You know, he understands. And I said, the other thing I said, you know, and I took this from Dr. Amjad, but Dr. Amjad said, we should absolutely, it should be considered in the equation more than just population, that we're the oldest and we're the most chronically ill. And that should be factored into the equation to get more vaccine. I'm trying everything I know. I'm trying every single angle and everything I know. And I'm going to keep doing it too. Because in this situation, I really believe we're dealing with a good man. There's been a lot of good people in the Trump administration that worked really hard. But in this situation, the squeaky wheel gets the grease. And that's what we're going to continue to be. We're going to be the squeaky wheel.
All right, thank you, Stephen. Next to Mark Curtis with Next Star Media.
Thank you, Governor and cabinet members. And this is, I think, a good follow-up question because the way I listen to this Everbridge system and this continued system of making age the #1 priority, I'm a little concerned. So, and I'm going to share some personal information because I think it's instructive, and I think there's a lot of other West Virginians in the same boat as me. Because I'll be straight up honest. I suffer from chronic heart disease. I have chronic lung disease. I'm diabetic. I'm overweight to the point I'm considered medically obese. The only criterion I don't have is I'm only 61 years old. I'm not over the age of 65. And one can imagine a healthy 75-year-old in West Virginia that has absolutely none of the medical problems I have. And I'm not looking for any help getting a shot on this or any favoritism or anything, because quite honestly, my company's working on it, getting me a shot sooner rather than later. But I ask because are we depending too much on age as the main criteria, where we could have a relatively younger person like me that has all the other risk factors versus a person maybe age 70 and older that has absolutely none of the other risk factors? I'd like the doctors and the governor to weigh in on my question.
Well, Mark, I understand all that you said and everything, and I really believe that Dr. Marsh is the best to answer this and everything. But Mark, I can assure you just this, that compared to where we were, you know, 3 weeks ago, how long would you have expected to have waited? It would have been unbelievable how long it would have been. We are far better off now than we were 3 weeks ago. And, you know, Mark, as fast as we can double back, you know, we're going to continue to double back. And we're not going to let you just, you know, lie in limbo. We're going to find a way that we can get you that shot and get you that vaccine, and we're going to pull it off. But Dr. Marsh, maybe you can help us there some too.
Yes, thanks, Mark, and thank you, Governor. I mean, Mark, you're exactly right. And as we look at our population approach, we know from the national data, from our own epidemiology data, that age is such an important criteria related to risk of dying of COVID-19 and risk of hospitalization. For those reasons, we have focused, as the governor has said many times, on the impact of age and the fact that West Virginia is an old state, the third oldest state in the country. But the point you raise is really important, and we certainly want to make sure that we are also taking care of other vulnerable West Virginians, folks with pre-existing medical problems who are over 55 years old, certainly people who come from vulnerable ethnicity groups, racial groups where death and severe disease is greater, and then looking at even younger people, problems like, for instance, morbid obesity, which turns out to be also a very significant risk factor for severe disease. So we are on the same strategic path that you suggest. And as the governor has done, and we've all tried to do, you know, the real key for us is getting more and more vaccines so that we can offer vaccine to all West Virginians, you know, across the board, but in a priority basis, to include those other medical problems that do put people at higher risk. And as the governor said, we certainly are not inflexible, and we always want to consider the individual involved too. So even if people aren't quite in exactly the age groups that we've dictated, if there's extenuating circumstances, and particularly if their physicians and healthcare workers feel strongly that they should be vaccinated, then we would take that into context and try to make that happen as much as we could.
Yeah, this is Bill. If I could, can you hear me?
Yes, we can.
Yes, let me add, Mark, that is an absolutely terrific question. Let me just say that the system will allow us to give priority to folks with underlying conditions. We're trying to roll out the system with 65 and over right now, and we plan on talking more next week about how we use this system in a little more detail in some other ways to prioritize. So you are right on target that we have individuals who should be prioritized over others. Let me also quickly say this system is very sophisticated. It will allow at the individual's request to receive text, emails, or telephone calls to confirm an appointment. So information can go back and forth in terms of that, and you can request a phone call rather than a text or an email to confirm or deny an appointment. And if an individual is contacted and they don't confirm the appointment, they maintain their place on the priority list. So that's a great question. We'll talk about this more next week as we roll this system out. We're trying to do this methodically, but we will be able to set priorities with the system for folks like that and folks like you. So thank you, Mark.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor and panel, and happy birthday, Jennifer. Question with the legislature coming back, Governor, do you have any package of bills that you would like to see addressed that would give you more power to address things that you haven't been able to address without legislative authority during the pandemic?
Oh, I surely do have, and I will have, and I would just share this with you. I spent from 10 o'clock to noon today, or till almost noon. I spent that time with the President of the Senate and the Speaker of the House, and going over a lot of stuff that we would be looking to come from either them or myself and everything, and also having discussions with both of them, welcoming stuff coming from the minority as well. So yeah, we're working on it nonstop. I think it's a little premature to bring that up right now, but we're on it. We're really, and I think you'll be really pleased with what we introduce.
All right, thanks, Paul. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking my question. Governor, a couple of court actions, which I'm sure you weren't surprised to see from education unions regarding going back to school full-time in class. And also there were several counties, 7, I believe, and correct me if I'm wrong, which decided not to go back full-time because of local school board decisions. Can you address those topics, please? And also the quandary of a non-elected board like the state board possibly taking action coming up in the next couple of weeks against counties that haven't gone back full-time, which are represented by locally elected boards. Some people are saying that that's a very sticky situation. Thank you, sir.
Okay, Kenny, what was the last part of the question when you were talking about as the board and a sticky situation? Say that one more time, please.
In addition to the lawsuits by the teachers unions or the injunctions, the court actions they've taken, and also the number of counties which have elected not to go back, the possibility that the state school board, which is appointed, could take action against local school boards which are elected if they haven't gone back into class, and some people saying that the local elected board should make the local decision. Thank you.
Okay, Kenny, let me just take a minute and try to go through the whole thing just 1 second, okay? First of all, there were 7 counties, and I think 4 of them have better come to their senses, and now we're down to 3 counties, with the idea that there may only be one county that's still holding out and going remote or whatever. And I think that's a mistake. But, you know, all these people are grown-ups, and, you know, and I think, you know, they're plenty capable of making decisions and being responsible for their decisions. I would say the same thing about, you know, our state board and our Department of Education. And you know, I know that they met yesterday and they adjourned and because counties were changing and there was some counties coming off that list and everything, and now and I think that they have another meeting that's scheduled here, you know, very soon, and I think really at the end of the day, you know, the way our Constitution reads and everything, they are the ones to make these decisions. Now, from my standpoint, here's how I see the whole thing, you know, and I want everybody to just stay with me on this. First of all, we know that our kids need to be in school really bad. We also know, and I'm probably going to miss some of this because I surely don't have any notes or anything to go by this, but we also know that just this is we have kids that are really hurting, whether it be special needs or situations to where, God forbid, kids are being abused or whatever it may be. There's all kinds of needs. And in addition to all of that, we know that there are kids, a lot of kids, a third of our kids are failing core classes by just trying to get through with the remote. So what are we going to do? What are we going to do? I mean, really and truly, at the end of the day, are we just going to let a generation or whatever have a big link out of their chain? Well, we can't do that. There's no way we can do that. Now, we can't be unsafe, can we? So then we go to the science. And what does the science tell us? The science and all the medical field all across the board tells us that from the 8th grade down, the transmission rate is almost nil. Now, and in addition to that, let's be real and be fair and just talk about it. You know, do our teachers, do our service personnel, are they safer in that situation, or are they safer, you know, meeting with their extended family or going to Walmart or the grocery store or whatever it may be? You know, well, I'm telling you, the science tells us overwhelmingly that the school's safe. We have more and more and more dollars that are flowing into the school system to do more sanitization and more things, more running to the fire when we have an issue or a problem. There's nobody on this earth that can make it 100%. And God, please don't let something happen to any of our kids or our teachers or our service personnel. But with all of that, then what we did is we went even another step further. We went another step further by saying, we're going to vaccinate all of our teachers and move them all the way up on the line. We're going to do the same with all of our service personnel. Move them all the way up to the front and get them vaccinated as quickly as we possibly can. And when you get the first vaccination, supposedly it covers you 50%. The second vaccination to all these people will be coming not very long. And then the next thing we did is instead of going back, we said, hold on, because it was brought to us and everything from, you know, through the discussions of the Board of Ed and everything and all the Department of Ed, you know, that said, tell you what we would want to do, what we think, and this is their decision, not mine, is we go to a blended model, a model that says you won't go back full time. You won't do that until we reach a point in time where you've received your second shot. Well, listen to me. If you don't want to go to work, that's what the problem is. You just don't want to go to work. You know, I can't help that. And if you're really in a situation to where the union leaders are out there just beating the drum and everything. And they did a marvelous job in the last election and everything else. And I have no earthly clue why you still are trying to cling to union leaders that took you down the wrong path. But I am telling you, just as straight up as it can be, I love our teachers and our service personnel and our schools and especially our kids. I don't want it to be 1 ounce unsafe. But I am telling you, all that I can possibly do, is listen to the scientists, listen to the medical community. Everybody says go back to school. Listen to the pleading of the kids. Everybody says go back to school. Listen to the pleading of the parents saying we got to get our kids back in school. Listen to the pleading of the economics of the people that can't afford daycare. We got to get our kids back to school. And then listen to me still stepping up and say, even if that isn't enough, let's give all our teachers and all of our service personnel the vaccinations. And then the school board says, no, that isn't even good enough. What we're going to do is we're going to go blended until we get the second shot. I don't know what else to do. I do not know what else to do. And they can sue till the cows come home or whatever it may be. You know, I don't know what else to do. Our kids need to be in school.
All right, thanks, Kenny. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello. So I really just have some clarifying questions. I'm wondering, do you all know at this point how many vaccines you're going to get next week? And as far as rolling out vaccine distribution to all 55 counties, could you give me a sense of, which counties are really need this the most, or which counties have really been without the vaccine?
General, you've got to handle this, sir.
Yes, sir, Governor. So, June, we know that next week we are still projected to get 23,600 first doses, and then we'll get the accompanying second doses. I don't have that number in front of me right at the moment. We know that we have to get to all 55 counties to be able to reduce travel time for individuals. And as pointed out earlier, we continue to build that across the state of West Virginia and the system. So the answer to your question is we need to be able to provide doses in all 55 counties in the appropriate system and model that meets those county requirements. And that's what the governor's continued to press us to build. And that's what we are continuing to build while we do the other clinics to make sure that we lead the nation in getting shots in arms. Because as the governor pointed out, we know that every shot we get in an arm, we have the potential to save a life. Thank you.
All right, thank you, June. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. What is the cost of setting up the Everbridge system, and where are those funds coming from? Is this CARES Act money? Is this the DHHR budget? And is this a one-time cost, or is this something that we, imagine paying for in the future as well? Thank you.
Secretary Crouch, I think you can answer this and just be completely transparent and tell Charles any and everything. Please do. As always.
Yes, sir, Governor. Yes, Charles, good question. The cost of this system is about $760,000 a year at this point. Those costs will drop somewhat in subsequent years. We weighed that heavily in terms of that funding, and the governor was very direct that to get the cost down as much as we could, and we did do that. The source of the funding for this right now, we're looking at additional funds that are coming in from the federal government as kind of a second wave after the CARES funding. So we will look at that. If we can cover this with federal funds that are provided specifically for the pandemic, we will do that. But DHHR is prepared to make sure that this system is paid for and put in place and that it functions well. This is a large undertaking. And again, we've done it in one week. There will be blips. We We ask everyone to please be patient, but we need this for our citizens so that they don't have to continuously call multiple times. And we have to fix this problem. And again, the governor directed us to fix it, and we're fixing it.
To me, just 1 second, Charles. We have all got to hope and pray that this is a one-time expense. And Charles, if you'll look at the dollars that are coming to us through the stimulus package that was passed, and it was passed a couple of weeks ago, or maybe even more than that, but it was passed and everything. We're not talking about the stimulus package that the Biden administration is now working on. We're talking about the $900 million stimulus package that was already passed, and there's dollars in it to pay for this, and we'll cover it with that. I didn't want to just lead right off and tell you that, but that's where we're going to get the money.
All right, thank you, Charles. Next, we'll go to Junaid Dill with the AP.
Hi there, Junaid with AP. Did we ever get the expected second dose of the second shipment of doses that you all said didn't come through on Tuesday or Monday? It seems like there was an infusion of doses earlier this week on the dashboard, so I wanted to check on that. Thanks.
General, you're going to have to answer that. I know the answer, but you can answer it better.
Yes, sir, Governor. So, Janae, no, we did not get any additional first doses above the allocation in what's called the Tiberius system, which was 23,600 first doses. We have gotten the second doses that accompany the first doses that we had administered in arms already.
All right, thank you. Next, we'll go to Maria Sellers with WVVA. Yeah, you may be muted, Maria.
Oh, hi. Sorry about that. I would like to ask one of the healthcare COVID officials. You spoke a little bit about today being the 1-year anniversary of COVID-19, but could you guys kind of elaborate a little bit more on where we go from here and how that has really impacted the healthcare field this year?
Gosh, I know our people can talk a long time about this one, but let me just try to take it on their behalf and just say, I know very honestly, if you can have honor with this, I would say every one of us has been to hell and back. And it's been tough. And it's been especially tough on all the frontline workers and all the people that have been out there, because, they've seen a lot of people suffer and a lot of people die. And, but at the same time, I think, for all of us, we're proud that West Virginia has 1,849 deaths and not 18,000. We're proud that West Virginia leads the nation in getting vaccines in people's arms, and we're on a glide path to finish up second round shots, not first round shots, but second round shots, to all the people in our nursing homes, all the residents and all of our staff. We're proud of what we've done with the assisted living. We're proud that we've recognized things like, hold on here, we do not want to be the state that's got vaccines in a warehouse, and we took practical approaches by using local pharmacies and local clinics and everything in our great National Guard to do all the work, that they've done. We're proud, very proud of West Virginia and how West Virginians have done and responded and listened and stayed together. So while it has been a journey that has really been to hell and back, There's no question that you've seen a lot of incredible work by the people that you see on this TV every day, and all the people that are in the background that are really, really putting in the licks. So I can never thank them enough. They make me look better than I am, and I just love them for it.
All right, thank you, Maria. Governor, I'll turn it back to you.
Well, I should have ended with that, but I'll end again with just this. If you're looking at across all these numbers, the first thing you look at in my book is that we lost another 35 West Virginians. And we've lost 1,849 West Virginians. And I've read every single one of them out of total respect to that family and all their loved ones. I really expect every one of us to keep these people in their prayers, or in your prayers. I can tell you without any question, from the standpoint of the state map, it's better. It's lots better. I can tell you without any question, from the standpoint of a grass that we have, this one right here on the top with this light blue and dark blue lines of how it's getting better, it's better. I can tell you we've still got a ways to go, West Virginia, to wear your mask, stay the course. We're going to get there. We're going to get there. You have absolutely shown the nation just how great you really are. You continue to shine in every way. And you don't do that because Jim Justice is your governor, or Clay Marsh, or General Hoyer, or our Secretary Crouch, or Dr. Amjad. You don't do that because of what we're doing. You do that because of just how blooming good you are. That's all there is to it. And I mean this, and I mean it from the bottom of my heart. And, and maybe I'm going to get in trouble for saying this, but who cares? At the end of the day, one of the reporters that's just so amazed about West Virginia said, forever out there, people thought West Virginia was poor and backward and didn't have any idea what they were doing, and on and on and on. How do you feel about the fact that West Virginia is absolutely shining so brightly? And I said, I love rubbing it in their face. And I mean that, because really at the end of the day, I'm here because I love you and I love this great state. And absolutely, we are the best. We should never have been the blunt end of bad jokes. We are absolutely the most beautiful and the best craftsmen and the best faith-based. We are the best. And absolutely, and thank God, the world's seeing it. The world's seeing it, and that's good stuff. And it'll only make things better for us in West Virginia. God bless each and every one of you. You just keep it up. You just remember you're the best.